I wanted to start off today with an important update about the City of Houston's Direct Assistance Program. The city of, and this is the program in which we're providing $1,200 to families in the city of Houston with the CARES funding. The City of Houston's partner, Baker Ripley, met our deadline to send out the first batch of direct assistance checks to families and individuals who have been affected by the coronavirus pandemic and need financial assistance. Last Friday, 2,355 checks were mailed, each one of these checks in the amount of $1,200 for a total amount of $2,826,000 distributed of the initial $10 million in that first batch. Of that, 2,085 recipients were from the Harris County Direct Assistance waiting list and 270 from the City of Houston's Utility Assistance waiting list. Today, another $2.5 million will be sent out to individuals as well. They represent City of Houston recipients who applied to the Harris County program but did not get assistance because the money ran out. Baker Ripley will continue to review applications through December 30th until all funds are paid out, and they're working with a list of about 50,000 individuals who have applied through various programs. The assistance program is funded through the city's portion of the CARES Act, and the money is getting to the individuals who need it most during the pandemic, and it's our goal to get as much of that out, these $1,200 checks, prior to Christmas, or certainly all of it will be distributed this month. It also points out to the need for additional assistance from Congress, and so we are hoping that they will be able to resolve their differences and provide additional assistance to many, many families throughout the country who need their help. Now to our daily COVID-19 update. Today, the Houston Health Department reports 745 cases of COVID-19, bringing the Houston's total to 1,004,962. Again, that's 745 new cases being reported today. There are 6 newly reported deaths, persons who have died as a result of COVID-19, bringing the city's total to 1,493. That is 6. And then, as you can see, you can look up on the board there, which means that this virus is still having a daily impact on Houstonians. So let us never forget that each number represents someone's loved one who has died of this insidious virus. The positivity rate is also up for this week in the city of Houston. It is now 10.5% compared to 8.8% last week. So the positivity rate is up. However, I will say that, Dr. Persse, when I looked at the daily numbers this morning from TMC, all the hospitals, the reproduction rate was down. It was now under 1. And when it's under 1, that indicates that the virus is slowing down. And so we just have to continue to look at it week by week to kind of see. So that's the good news. And then today, the number of people in our hospitals were right at 1,200, which was kind of roughly half of the numbers that we saw during the summer. And then in terms of the ICU, we are still operating, as of today, in that the first phase. We're not in surge capacity, but close. So again, it's just a reminder for everyone to continue to mask up, to engage in social distancing, to exercise, clean your hands, sanitizers. We need to continue to do that, even with the vaccine on its way. So even with all of the hope and the anticipation and the vaccine will have on this virus, we must continue to do our part. Now, the Houston Health Department's response to the COVID-19 pandemic has been nothing short of extraordinary. And so I certainly want to acknowledge Director Williams for his hard work and his staff, Dr. Hopkins and their staff, all of the work that's been done by the City of Houston Health Department. From a nationally recognized testing strategy focused on access and equity to robust contact tracing to ample human service support, the health HHD is a national model. Another reason HHD stands above is innovative strategies to understand the impact of this virus on our community. You may recall the wastewater testing project that helps precisely target life-saving interventions. Today, we will outline the results of the department's Antibody testing survey, a partnership between the Houston Health Department, Baylor College of Medicine, and Rice University. I want to acknowledge representatives who are here in the room. This survey, conducted in September, provides us more information to inform our battle against this deadly virus. And here to announce the results is Houston Health Department Chief Environmental Science Officer, Dr. Loren Hopkins. Dr. Hopkins.
Thank you, Mayor. This survey is a partnership between the Houston Health Department, Baylor College of Medicine, and Rice University. So most people tend to get tested for COVID-19 if they have symptoms, but as many as 40% of people who are infected don't get symptoms. That means testing data does not give us a complete picture of how many people were infected in our city. But people who were previously infected with a virus that caused COVID-19 have antibodies in their blood, regardless if they have symptoms. This study estimates how many Houstonians have already been infected with COVID-19 by September by testing their blood for antibodies. Phase 1 took place September 8th through the 19th. The Houston Health Department partnered with the Houston Fire Department to visit 420 randomly selected Houston homes. Participation was really amazing, with a total of 678 people volunteering to give blood samples for this effort. Our results show that an estimated 13.5% of Houstonians, which is approximately 250,000 people, had been infected with COVID-19 by September. The estimated number of people with antibodies for COVID-19 is approximately 4 times the number of reported PCR cases in the health department database in September 2020. That means 4 times more people had the virus than was previously known. High positivity rate areas had more people with antibodies than lower rate areas. More women than men had antibodies. The prevalence of COVID-19 antibodies was higher among Hispanic and non-Hispanic Black residents as compared to other racial groups. The prevalence of COVID-19 antibodies was higher among younger people as compared to people 40 years and older. So what's next? The second phase of the study is planned for January 2021. It's 2 phases, or 2-pronged. People who tested positive for COVID-19 antibodies will be asked if they'd like to be retested, and that is to measure the amount of antibodies they have 4 months later that we found in September. Researchers will randomly select another 420 households in low and high positivity rate areas, and again ask for volunteers to give blood samples so we can get another snapshot of what the prevalence rate is across the city. So the second phase will measure how much the virus has spread since phase 1, and also how antibodies decrease over time.
We'll certainly come back to questions to Dr. Hopkins. Fascinating survey, which reflects that the virus was probably prevalent in our community 4 times the reported numbers that we have, which also underscored the importance of wearing these masks and the social distancing. So that's important information to have, and thank you, Dr. Hopkins. Today marks also an important milestone in our efforts to slow the spread of COVID-19 in our community. Since March, for 9 long months, we have battled the global pandemic. This morning, the first COVID-19 vaccine shipments arrived at 4 hospitals around Texas, including the MD Anderson Cancer Center in the Texas Medical Center. I want to certainly be clear that even with this important steps, and with approval by the FDA of the Pfizer vaccine, we still need to do our part to fight this virus. We are still in the midst of a pandemic, and every precaution must be taken to slow the spread and save lives. It is great news that the Texas Department of Health and Human Services announced that tomorrow more of the vaccine will arrive in Houston, specifically at Texas Children's Hospital, Maine, LBJ Hospital, St. Luke's Health, Memorial Hermann Texas Medical Center, and Houston Methodist Hospital. We know that frontline healthcare workers and residents of long-term care facilities are the first group to be vaccinated. They are on the front line, so that's quite understandable, and the vaccine is voluntary, and it will likely be months before anyone who wants it can get it, but the process is starting. And so let me encourage our hospitals, those who are going to be getting it, especially those who are getting it now, the MD Anderson, the other hospitals at the Texas Medical Center, to start putting those vaccines to use as quickly as possible. I certainly would love to see them do it, Dr. Persse, just on the very same day that they get them. Just to point to the urgency of it, let me also encourage them to make it the utilization more transparent, more available, so people can see our healthcare workers, many of them, some of them taking it, when so many people in the general community are hesitant to take it. I think it's important for them to see our healthcare providers and people in our Texas Medical Center and our hospitals taking it. So let me encourage them to start those vaccinations as quickly as possible, like yesterday. So quite frankly, if you're getting it today, I would love for you to do it today. If you're getting it tomorrow, I would love for you to start the process tomorrow. And then I think it's important to provide access to the media when some of them are getting the vaccine, because it's important for the people in the community, in these communities throughout the city of Houston, from Kingwood to Clear Lake to Fort Bend to Denver Harbor to Fifth Ward to Acres Home, to see our healthcare workers actually taking the vaccine. I think it would create more confidence and make people feel better to see it. So let's not keep it behind the walls of the hospitals. Let's kind of make it available. It was good to see Governor Cuomo, for example, this morning, and making it available for people to see the first person in New York getting that vaccine. I thought that was very positive. Let me encourage the city, the largest medical center in the world. Let's be on the front end. Let's make it visible, transparent, because it is important for people to have the greatest degree of confidence that this vaccine is safe, reliable, effective, and we want as many people to get it as possible. I intend, as soon as my name is called on the roll, whenever that is, I intend to get it, to take it, and to take it in a very public fashion. Now, having said that, let me turn to Dr. Persse.
Thank you, Mayor. And yes, the virus is still here, but so now is the vaccine. And so we need to get moving on the vaccine. We need to get it out. We need to get it into people's arms. We need to demonstrate to people that they can feel confident with this vaccine. So the vaccine is new. Its technology is new. There's been a lot of attention in making sure that it is developed in a safe way. And one of the things we hear, people are concerned that it was developed very quickly. And yes, it was developed quickly in less than a year, but the technology behind this new vaccine actually goes back to 15 years ago when we first dealt with SARS-1. So there's nothing really new about the technology. It was all set up, ready to go, had been tested, had been proven in other vaccine trials with SARS-1. But SARS-1 went away. So there was no reason for mass vaccination back then. But all that infrastructure was in place. All we needed was the genetic code for this new virus in order to get things going. So on one hand, there's an appearance that it came up quick, and it did, but all the backbone, all the industry, all that stuff already existed. So there's nothing from a scientific standpoint, there's nothing that was rushed in this. So the vaccine is very safe. So as soon as we get vaccine and we can start getting it into people, then people will see that the side effects are what have been advertised, which is that they're, for the most part, they're pretty mild. They're like you would get with any other vaccine. People can expect to have a sore shoulder, a little muscle ache, a little bit of fever for a day or so, probably easily treated with a little Tylenol or a non-steroidal like Motrin or something like that, and move on. A lot of information has come out about the two healthcare workers in the UK that had some serious reactions. What has also come out is that those two healthcare workers had serious reactions to previous vaccines. And so one of the things that we've come to learn as we look at it is that they actually had allergic reactions to previous vaccines. And what we now know is that if you've got allergies to other things like peanuts or shellfish or to latex or something like that, those are not reasons to be worried. You really only need to be concerned if you had a reaction to a previous injected medicine or vaccine. So let's get those vaccines out and get them going. And then the other thing I just want to comment on is the prevalence study shows that the amount of people that have been infected in Houston is 4 times what we thought it was. So to the point that the mayor made and that Dr. Hopkins made was that the virus will continue to spread because of its nefarious nature. With so many people being asymptomatic, it is the sneakiest of viruses. And it is out there, it is in the community. Now, yes, the R value dropped down to just under 1 today, but you can see that our positivity rate went up, and there's usually a little bit of a lag there. But nevertheless, 10%, and you'll also notice from that slide that a lot of people are getting tested now. So we have great confidence that 10.5% is very accurate. So there's a lot of viral activity going on right now. So the vaccine is the great news is coming out. This prevalence study is giving us tremendous insight into what has already happened. We need to pay attention to what it teaches us. We need to remain diligent. Well, the good news is that the vaccine is here. Absolutely not a reason to drop our guard. Remember, we as a community drove this virus down. I want to say away, but we drove it down in August because of how we changed our behavior. We can do that again. Right now, it's got the upper hand. It is sneakily creeping up. And the virus is on the horizon, or the vaccine is on the horizon, but do not drop your guard. Keep your fists up. Fight this virus. Beat it back down to where it belongs.
Thanks, Dr. Persse. Get tested, get tested, get tested. Keep these masks on. Wash your hands. All of those things we need to do, even with the vaccine being here in the city of Houston, and it will be taken in phases. Some this month, then January, February, March, April, until everybody has access to it. So that's what we want to emphasize.